Welcome back to Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting at Neck of the Woods Brewing Company in Pittman, New Jersey with my good friend Dr. Frey. Dr. Frey, how you doing?
Spectacular.
It's a good old Tuesday. We're back in the brewery. We're recording a podcast.
What could be wrong?
What could go wrong? Exactly right. Before we go take a deep dive in our show tonight, we want to give a quick shout out to our sponsors, Virtual Orthopedics and Spine. They have you covered from runners, knee to dog walkers, hip to yard work, back and laptop wrist. Guess what? They have a doc for that. So find the right specialist for you at virtual.org/ortho. So tonight, Dr. Frey, we went from kind of having, not that we didn't have a topic, but we were kind of scouring the internet.
What do we do?
Yeah, what do we do here? And then, as nature would have it, a bunch of different things fell into place.
People get hurt.
The football world continues on.
Yeah, like a machine for us.
Yeah, right. It's prime week. We just finished week 10 in the NFL season.
That's fast. Can you believe it? Week 10.
It's crazy.
I know.
It's unbelievable how quick it goes. So I think we'll just kind of hammer out our list we have here.
Yeah.
I think we'll start with, actually, before we go ahead and keep going, I just want to give a quick shout out. Today is Veterans Day, so a thank you to all our servicemen and women 100%. Out there. Thank you for giving us this great country that you and I have the freedom to do this awesome podcast, drink beer, and talk about things we like, which is just sports medicine. So thank you to all those people who are out there who are listening.
Who do it for us, right?
Yeah, absolutely.
Take the big
I know
risks.
this will be released on Friday, and so a little couple days late, but we want to make sure we send our love and our flowers to those people who got us to this point. So before we go ahead and go into it, just to start on our stories here, interesting story came out this weekend about Alex Singleton, who also is a former Philadelphia Eagle. So, we do kind of focus on the
We love that angle.
We love that angle, right? But very interesting story in that he was, I'll just kind of go right kind of how it unfolded, right? He took a random drug test from the NFL, was tested positive for elevated levels of hormone HCG. Sorry, I can't even say that right.
Yeah, human chorionic gonadotropin.
Right. So typically with that, it's assumed that the person with those elevated levels may be taking a performance-enhancing drug.
That's the first thought that comes to
right?
mind.
Like, it's like, oh, that's not good.
Yeah. Sorry, buddy, you failed.
You failed your
this
test,
is bad news for you.
But per the article that I read was that Alex was saying that he's like, hey, no, I'm really health conscious. I'm not putting anything in my body. This is kind of concerning that it happened. And I think that, so right now.
Steadfast.
Yeah.
I didn't do it.
Yeah. So now, as mentioned, he was former Eagle. Now he's on the Denver Broncos. And so the Denver Broncos medical staff had set him up with a urologist and a couple other different physicians. He got a ultrasound and a CT scan, and then ultimately came down that he had a cancerous tumor or testicular cancer.
Yeah.
So crazy part is that happened, and then following that, the Denver Broncos play the Raiders this past Thursday in Week 10.
Plays the game.
Then goes and has surgery to remove the cancerous tumor on Friday, and is now out until the foreseeable future. And per his, I think his social media post, he says he's going to try to get back to the field in the coming weeks.
I have no guidance for you on how that's going to work out.
Right.
Yeah, I imagine that he will come back and be every bit as good as he was.
Yeah.
I have no idea what the timeline would be. Just outside of my lane. Pretty amazing how they found it, right? Like
yeah. And I think it's one of those.
A lot of luck.
Yeah, and I think it's even a similar story to another Eagle of
right.
John
Long
Darrenboss.
snapper.
The long snapper who was traded or was re-signed by the Saints. Did his physical.
He traded to the Saints.
Yeah.
And then did the physical.
And then he found, I think, a cardiac issue.
I think it was abdominal aortic aneurysm, if I remember correctly.
Yeah. So, kind of a big deal, right? And so then he had these, he had that taken care of.
Possibly would have died. Like, it was pretty bad when they found it.
Right.
And then, football career was over.
Right.
But he was the longest tenured Eagle in history at that point, right?
Right.
Long career and just dumb luck, right? Like that he went through this testing at that time and they found it.
Mm-hmm.
And for this guy, for Alex Singleton, I guess just randomly unlucky that his name came up as drawn to be drug tested, and that's one of the things I guess that goes up.
Right. Right. And it's just
with testicular
crazy
cancer.
timing and just kind of how it works, a blessing in disguise. And I think,
and I wonder how many of the docs like when he failed the drug test were like, yeah, buddy.
Yeah, sure. You don't take anything. Right.
We're like, we don't hear that every day, like, and then sure enough,
goes or like the classic, let me guess, you took a tainted supplement you didn't know had this stuff in it, right?
I had no idea.
But unfortunately, or fortunately for him, he was being honest, and this kind of came back, and it's like one of those things where, again, with in the same breath as the Darren Ball story of like these pre-participation physicals that we put these athletes through is like, usually it should be kind of quick and just
almost every time.
You're good. Okay, everything looks normal. Okay, go have fun, go play sport. But then sometimes when you catch these things, it's like, holy cow, like that's why at least in my world at work when we do our stuff, we have a cardiologist on staff that helps us, and it's like, okay, you have to get some further cardiac workup. Yeah. Most of the time they come back fine, everything's good, they go about their business, they might have a couple follow-ups here and there. It's like, I'm glad we did that because now there's the chances of you having a cardiac arrest or something along those lines is much slimmer because we investigated this, we did what we needed to do.
Right.
And yes, it can be frustrating, it can delay your clearance to play your desired sport, but at the end of the day, well worth it.
That's a very annoying one for anyone who's on the other side getting held up. In the end, if you're the one who are like, thank God we caught it.
Yeah. And I mean, I can even go and to tell a quick story too of I once had a cheerleader who was having some issues with some dizziness. She may have had some like syncope episodes after doing some tumbling, going upside down. Right. And we had our team docs look at her, and then after some investigation and some neurological testing and stuff, she was diagnosed with MS.
Really?
Yeah. So it was.
That's young.
Yeah, very crazy. So the collegiate.
That's like juvenile at that point. Like that's really young.
Yeah. So it was she was in college, obviously, and like I said, she just came to us. She was like, "Yeah, I might have like kind of passed out the other day after doing some backflips," and I was like, "Whoa, okay, well that's not good.
Lay off the rude doggies."
Yeah. So let's talk to our doc. And I remember at the time our training room clinic was ran by fellows, so the fellow came in. He was like, she didn't pass her cerebral exam. And I'm like, well, I don't even know what that really means. Like,
right.
Because no one's ever said those words to me. And I was kind of younger in my career.
Yeah.
And he was like, yeah, we should definitely get some workup. We got a brain MRI. Brain MRI came back abnormal. Lo and behold, did some extra workups. And she was, early diagnosed of MS. And it was like, holy cow. Like,
and that is sometimes a very, very difficult diagnosis to make. Yeah. It's one of the great mimickers sort of thing where like just random weird things that don't make a lot of sense happen and then go away and then happen. Like it's that is a great story.
Mm-hmm. And it's one of those things. And I applaud Alex Singleton.
Not great that she had it, but
great discovery.
Great
right. And I applaud Alex Singleton for he even said in his social media post, he goes, I was unsure if I wanted to make this public, but I figure it would be a good thing for everybody to get kind of spread awareness a little bit.
Wonderful guy.
Right. Idea of like men's health and other things like that. And if you don't know how to check yourself or do those things, it's a very quick Google and you can figure it out. And those things, early detection that's where I think also in the article I read, it was like, in his case, great prognosis. It should be fine. It was found early detection.
Yeah.
So again,
amazing. Some are very treatable if you catch them early.
Right. So that's great news for him. But it's also interesting too in that Alex Singleton was coming back off a torn ACL this year that he suffered in September of 2024. The story on that is that he tore his ACL in the first quarter of the game, continued to play on it the rest of the way, had a good 10 tackle game, no big deal, and then afterwards got it all fixed up and was done for the year. But just a guy who's been through a bunch of different stuff.
Tougher guy. Yeah.
And just a standout guy in general. So
I have to imagine the downtime on this. I'm lying. I was going to say I have to imagine it's fairly short, but the truth is I don't know if there's follow-up chemo. I don't know if there's other things that go into that. Right. So the truth is I don't know if the downtime is very short. I know if it gets further along, very clearly there's additional treatment, chemo and whatnot.
Right.
But if you catch it very early, I don't know how that plays out. I hope for his sake that he doesn't need to go through all of that.
I agree, yeah.
But the truth is, maybe he does. Maybe that's just how.
And I think in general, all the articles I read about it, it seems like it was very optimistic. And like I said, he was quoted to come back on the field in the coming weeks. So I also don't think that he was placed on IR. Again,
That's a really good sign.
like a good sign of like
Right.
he's not out for the minimum of 4 weeks. So that
Right.
could be some optimism in that, in the hidden details there.
Yeah. Yeah.
But again, this is like we've mentioned, a little bit out of our wheelhouse for sure.
For sure.
And that we'll kind of follow the story as it goes and kind of see what happens.
Yeah. Yeah. Hopefully this is one of those feel good stories.
Yeah. So then to go down our list some more here, we have Jayden Daniels, the quarterback for the Washington Commanders.
The most prominent, obvious story.
The big story from last week.
We couldn't record last week, so we sort of missed an opportunity to cash in right away.
Right.
But yeah, like this was the prominent injury.
But I think with that said is that, early on, there wasn't that many details about his injury and what happened right away.
Yeah.
Like we mentioned, we recorded on Tuesday, so that happened on that Sunday, I believe.
Right. And this was before YouTube yanked. Yes,
Yeah.
No.
Right. So he went down, he got tackled, he suffered a dislocated elbow on his left non-throwing elbow, which is a good positive note for any Commanders fan out there.
Very much so.
And that, per the reports, his MRI showed no fractures or ligament damage, which is also very beneficial.
Incredibly.
And then again, with the silver lining weeding through the details, the Washington Commanders have not placed him on IR, which would give him a minimum of 4-game absence.
Right.
So what are your thoughts on his story and kind of like his outlook after?
So slightly out of my lane in terms of not as far out of my lane as testicular cancer.
Right.
But it's slightly out of my lane in terms of the elbow dislocation. Often goes to the hand and upper extremity guys in terms of treatment.
Mm-hmm.
But just sort of basic general knowledge of these things is that they are gruesome injuries.
Yeah.
They are, and shockingly that they're usually well tolerated once you get back. It's surprisingly so. There are a lot of those injuries and that's the different things we talk about on the show here and there, and like potential career ender and this and that and all these other things. And don't get me wrong, there are different types of elbow dislocations. The majority of them are what we call posterior lateral, the direction that it goes in and the way that it goes out. And his looked like it was likely posterior lateral. And then there's the possibility of neurovascular injury, and that completely changes the game.
Right.
But there's a few different things that we look for in terms of prognosis. One is if posterior lateral tends to do okay if and when it comes back. Number two, if there's not a ligamentous injury, and oftentimes there isn't. I don't know how. I don't understand how there isn't.
No,
but
I
oftentimes there isn't. And if there's not a fracture, there's a couple bones that will sometimes break when this happens. The coronoid, a little piece of the bone in the front, or an olecranon fracture. And if there's a fracture, it sort of changes the outcome somewhat. And that's always one of the things you're worried about acutely. Is there a fracture? Is the fracture in the joint once you pop the joint back in? Is it going to come back out again? And so there are different things we want to make sure it looks nice and symmetric when we do our x-ray. Sometimes you get a CT to see if there's something inside the joint because you get it nice and quickly. These guys probably get an MRI right off the bat because that's how it always goes. Assuming none of those things happened, assuming the ligaments are okay, assuming that there was no fracture in it or an incarcerated fragment of bone within the joint, they bounce back relatively quickly. And unlike your shoulder where you dislocate and it's almost always going to happen again, or your patella where it's almost always going to happen again, usually that's it, one and done. You're back to normal. You usually lose a little bit of range of motion. So it's a huge plus that it is his non-throwing arm, right? So it won't impact him in terms of that. But once it heals, his elbow should be stable. He should be able to get back to playing and doing what he needs to do with his left arm. So I think his career, he's had a rash of injuries recently, and everybody has Robert Griffin on their mind. Oh no, here we go.
But the comparisons between the two are crazy.
Isn't it nuts?
Have you noticed that it was, I think, if I'm not mistaken, it was against the same team on roughly the same yard line, around the same time, around the same down of play.
I didn't know all of this.
It's like the Alex Smith, Joe Theismann, Washington, whatever's going on with that field.
Weirdo.
A parallel universe.
Coincidence,
Just coincidence how so many things happen. But yeah, I think the story is much different, right? If it was his throwing arm.
Right.
That's a whole different ball game.
And again, a little bit out of my field, but even with that, I think he gets back to throwing. I just worry that the few degrees of range of motion that he loses on the after this and his throwing arm maybe that makes the difference for his ability to be as good, successful as a quarterback in the NFL.
And I think,
but it's not his throwing arm.
Right, and I think again, just to dive down that idea, if it was his throwing arm, I think that lack of range of motion would mean there's compensation somewhere else in that kinetic chain. Essentially, he would start developing shoulder problems or something along those lines, and that's again affects his career long term.
Right.
Whereas this, again, like we mentioned, not throwing arm shouldn't really be a problem.
Right.
If anything, it might affect his confidence scrambling and running around a little bit.
Right.
But I would imagine that the Commanders are going to have him braced in some capacity going forward.
Sure.
It's not going to hinder his mobility and ability to throw as a quarterback with having your offhand kind of braced or whatever the case is.
Right.
So that's good, again, for his standpoint.
And he's got incredible legs, right? And he's got an unbelievable arm. And makes a lot of really good decisions with the ball.
Mm-hmm.
Like if you're going to hurt anything, probably that arm.
Right.
The left arm. The non-throwing arm.
Right.
That's the one you don't need as much.
That and, I think the other thing that's on his side is just youth. He's young, so that's also very beneficial.
Another good point.
I don't think any of the
Wasn't my man Aaron Rodgers out there.
Right. If I was going to say, if it was an older quarterback like an Aaron Rodgers or something, that might be a little bit more of a issue going forward. But this guy's got plenty of career left in him. I don't think it's going to really change his
He was young like Joe
his
Flacco.
potential. Right. Yeah, right.
That guy's been amazing.
So good, right? Which, you mentioned it, and I'm going to jump ahead real quick.
Mm-hmm.
But reports is that Joe Burrow is now back in the practice facility in a limited capacity, which is pretty interesting and a little bit earlier than we expected, I think.
Yeah. My man, Dr. Brandt, and they're not out of it.
They're not out of it.
So they're a little far down, but
they're not completely out of it. And Joe Flacco can work some magic to make it more interesting going forward.
Hang on a game or two.
Yeah.
Burrow. Yeah. So who knows? Maybe we are seeing that guy again this year.
Yeah, and I think we were all kind of not.
I drafted him, then I cut him.
Dropped him. He is right now the hot topic if in our fantasy football league group chat with the guy who's in the top. He's trying to sell him off like he's going to be important. I'm not buying.
Yeah.
Not buying that whatsoever.
Not quite yet, but you never know.
And then to go with some youthful NFL names, former Heisman Trophy winner Travis Hunter, number overall 2 pick in this last year's draft.
Yeah.
Breaking news today was that he's out for the rest of the year now with an LCL surgical repair, which is rarely interesting because this whole story for him is crazy, right? He won the Heisman. He played offense and defense. The
Ohtani of football.
Yeah. And I think he came up at the right time as Ohtani did so good and doing all this thing. And then you have someone else like a two-way player like him come out.
Yeah.
And then he's with the Jaguars. He plays a little bit of offense, does okay. Plays a little bit of defense, does okay.
Yeah.
And then the background.
Probably a little better offensively.
Yeah, definitely a little bit better offensively. And the reports were kind of like, we're going to get him more involved. And I think they had a game overseas. I believe it was in London. At this rate, I forget where they're
Ireland, London,
London, or whatever.
I think they were just in Germany this past weekend. Maybe you're talking about this past weekend.
No, it was a couple weeks ago.
Oh no, Atlanta was in Germany.
Yeah.
My bad. Sorry.
So he played the game. He scored his first NFL touchdown overseas. Looked really great. He had his best offensive statistical game on my fantasy football bench, mind you, but does really well. Then I think they go, typically how the NFL sets it up, which is kind of nice for them. They do the overseas game, then they kind of go right into a bye week, so they have time for travel and all that stuff. Then I believe on the 31st of October, Halloween, he went down and practiced with a non-contact knee injury, which is like big red flag when you hear the non-contact knee injury. And then he was placed on IR. So he was out for a minimum of 4 weeks. So that was in week 7. So week 7, he scored his touchdown in overseas. So week 8, he got hurt. And now we're, like we said, about 2 weeks ago, we're starting week 11 now.
Yeah.
And then it got reported today that he was getting his LCL surgically fixed, which is just, all of it's just really interesting to me because, obviously you hear typically the non-contact in knee injury.
You go right to ACL.
Right, ACL, right? But this seems to be like a isolated LCL injury.
Yeah.
However that happens.
This is the kind of conspiracy theorist in me starting to edge up a little bit. I kind of think I remember, and I could be way off base, But I think it was Ireland. Maybe I'm totally wrong about that game that you're talking about. But I sort of remember him taking a hit in the knee near the end of the game and thinking to myself, "Oh, did he just get hurt?"
Yeah.
And then again, I'm trying to put it all together as I'm going through it. But like, was it I think the next week that it was the the bye week injury?
Right.
And was it actually a bye week injury?
Right,
or was it
right,
really
right.
at the end of that one particular game?
Or did, like you said, something happened then and it kind of jeopardized the stability of his knee. Then he does something that he's done a bajillion times, and then something gave out, and it's like, whoa, that's
what we worry about, right? Yeah.
And I think the LCL in itself is just so hard to really injure.
Especially isolated LCL.
Isolated, right. Like, for example, we
but
discussed this last year with Rashee Rice from the Kansas City Chiefs with his LCL repair.
Right.
But he also had an ACL. I think he had an ACL-LCL combo, if I'm not mistaken.
He might have been straight LCL. He might have been.
But with that one, right, like we saw Patrick Mahomes go into the inside of his knee and push his leg outward.
Right.
Like that made sense.
Yeah.
Obviously, yes, there's probably film of this injury happening at practice, but it will never be released to public.
Sure.
So that's like, practice film or
Unless
whatever.
we actually saw it in the game and just
Right.
don't. No, I'm joking. I'm joking.
But so really interesting.
Yeah, and then so like the timing of it does speak volumes, right?
Mm-hmm.
So theoretically there are two things you can do. Well, first it's like if it is just LCL, right? Like is it just LCL or is it actually posterior lateral corner? So it's the ligaments on the outside of the knee, but not the LCL alone. And that sort of changes management. And then two, timing of surgery. If it is really the injury is only 2 weeks old and they're operating, they are probably doing a repair,
Right.
Which doesn't happen quite as frequently. Really, only if it's for the most part just an LCL.
Right.
Otherwise, you start going down this road of a reconstruction frequently. If this was like 5 weeks out, 6 weeks out, we know they're not doing a repair. They're doing a reconstruction. At that point, you've kind of missed the boat on doing the repair. So if they are doing, if truly, honestly, if he's getting early surgery this quickly, I think there's a reasonable chance it is just the LCL, random injury, sort of strange, and they're actually just repairing. They're just reattaching that ligament. You could tear at the top where it comes off of the thigh bone. You could tear at the bottom where it attaches to the top of the fibula, the little bone on the outside of the leg there. Sometimes they'll tear in the middle. Those ones don't heal quite as well.
Right.
You're probably going to reconstruct that instead of that. But he is probably getting a repair. As you see with the Rashee Rice, like it can work. I imagine he's going to still have a really good career, and I imagine he's going to be fine. But I will say there is a little bit of a question mark there. Like is he not quite the same? Because they aren't always. They aren't always.
And again, I think he kind of goes along the same line of he's got youth on his side.
For sure.
Right? And I think we mentioned this a little bit with the Rashee Rice last year of like, you got to protect your investment a little bit, right? Like this guy's a Heisman Trophy winner. He's a game changer. He's having this knee injury. He's having these problems or whatnot. You don't want him to go out and make it worse this year and affect his career long term. So intervene early, fix it, chalk up the rookie season. Sorry about it, but you have plenty of time left to like make your impact in the league.
Yeah.
And then the Jaguars go ahead and they trade for Jacoby Myers, so they make an uplift in their wide receiver room.
Yeah.
So I think, which is also interesting too, the timing of it. Again, the devil's in the details. We don't know all the medical information. We don't have access to those charts and all those things. But that's a good little, ace in the pocket there of like they traded for Jacoby Myers, maybe knowing that this was going to be coming around the corner.
Right.
So they bolstered their team up, and then they're like, okay, well, we lost our guy for this season, but now we got somebody else to help out with our,
Maybe not quite the same, right? Like,
right.
Yeah. But someone to help fill the void.
Yeah. So I think, I think for the most part,
recovery is a little quicker.
Yeah, that's what I was going to go to.
With that repair,
right,
than it is with your standard reconstruction.
Right.
And reconstruction is still a little longer than like if it's with the ACL. If it's with the ACL, like that combo injury, you're looking kind of the year-ish sort of a thing. If it's just ACL, like last time's 9 months, right? Like,
right.
And if it's reconstruction for LCL, posterior lateral corner, maybe 6 to 9 months. But if it is a repair and it's just straight up LCL, 4 to 6, like a little bit faster, a little bit faster than it would be otherwise.
I think it's also nice with the lack of pressure of trying to return this year or anything like that. He'll have plenty of time from, it's November now, and so he'll be kind of 6-month marker by May.
Yeah.
And he's got pretty much all summer to get back in like kind of his groove there and getting back in game shape.
Yeah.
Be ready for camp, no problems.
I wonder if they say, hey, buddy, great experiment, trying to play both sides of the ball.
Right.
Here you are hurt. Next year, you're just going to be a receiver.
That's actually a good point. Like, I wonder if that does affect his ability to, double dip and go play two-way.
Both sides.
Yeah.
Yeah.
That's a good point.
Yeah, we'll see.
I think it does. I might agree with you here in that he's going to go one way or the other. And I think based off the sample size that we have, he's been more effective or maybe more beneficial to play offensively.
Yeah, I think that's where of those two sides of it, that's where he's most valuable.
Yeah. And I think you can get other guys who can play defense effectively, but
can't catch.
right. They're good at batting the ball, not
that's right.
Exactly.
That's right.
So, we'll see what happens, but I think he's very much on track to come back for the next year, no problems.
Yeah.
And then we'll go with that. Another interesting knee injury from this past weekend and kind of like adding things that's kind of compounding injury for this poor individual, Garrett Wilson for the Jets, down with another knee injury.
Yeah.
I think he went down with a hyperextended knee that kept him out for about 2 games. I think it was a total of 3 weeks.
It's a little bit fast.
He comes back, and then I think he went to go dive and make a catch and fell on his knee again. And I think early reports from what I got is it's potential PCL.
Man.
From our guy that we were so heavily excited about in the pre-draft show, Ricky Pearsall, who's down with a PCL injury, who's not doing great and still is not playing.
Sometimes that's how it goes.
Now you have someone, Garrett Wilson, also, because that's what when I read an article about the Garrett Wilson injury, they compared him to Ricky Pearsall, and I was like, well, if they're making that comparison, I guess they know something about it might be a PCL based off. I didn't really see the injury video per se, but with that being said, and the Jets' recent fire sale of all some of their playmakers, if you will,
right.
It's not the best outlook for him. I don't think he's coming back soon.
Right.
Especially with already banged up knee.
Right.
Like you already
hyperextension injury, trying to come back from that. What sounds like a PCL injury right now. Team that's did have potential at the beginning of the year, but not really in playoff contention at this point. Like, why are you going to rush him back? Why? Yeah. So I would be very surprised if we see a whole lot of them down the stretch here. Yeah. And it is, like we said, shockingly, we're already in week 10.
Yeah. You figure what? There's 8 more weeks, which is...
Yeah. Can he come back between now and then? Probably.
Yeah.
Will he come back between now and then? I don't know if this is the best idea.
If the Jets are way out of playoff contention and he's playing you can play a football game at roughly 80%.
Yeah.
Give or take. Like, football is a grueling sport. It's very painful. It hurts. People, a lot of these guys are dealing with a lot of things. Yeah, you could play the game about 80% of what you are. But if it's really for nothing and there's nothing on the horizon of playoffs or anything, then you might just chalk that up and let me get back to 100 and give it another swing at it next year.
Yeah. If he comes back, I would predict maybe last 3 games of the regular season if he comes back. And then if they're 2 and whatever it is, what's the point? What are you doing? Yeah.
So with that being said, if they kind of take the approach of he might be done for the season, do you think it's not common, but do you think they fix it if it's torn?
Not necessarily, right? I don't think that should be the driving factor on whether or not you fix it.
Yeah.
So it is a little bit tricky because he has hyperextension injury on top of this injury.
Yeah.
Is anything else injured?
Yeah.
But typically, isolated PCL, you don't.
Right.
You don't. And that shouldn't be the driving factor.
Yeah.
How much time do you have? What's normally the driving factor is people normally do well without fixing it. The issue is that every now and again someone doesn't do well, and then you're frustrated that you burn some of your clock, right? Like the clock to getting back on the field doesn't start until the surgery happens. You know what I mean? So if you wait to do the surgery, but on the flip side, if you roll the dice, if you gamble and you don't do the surgery, there's a pretty good chance you're not going to ever need to do the surgery, and then in the end, you get back more quickly.
Right.
And oftentimes it's better with the PCL surgeries. Lots of times, they almost all stretch out just a little bit, really, with PCL, and results are good. They're not spectacular. And
Right.
if you can get by without doing the surgery, you're better off getting by without doing the surgery.
Yeah.
And so my gut is that they don't fix it. They let him. They don't. It doesn't unless there's additional injury there.
Right.
My gut is that they don't do the surgery. They, if it's full on, fully torn, grade 3, like maybe they are. But anything short of that, my gut is, and even with that, lots of times we won't do the surgery.
Right.
But my gut is they won't do the surgery. They'll see how he's doing. Unfortunately, if 3 months down the line he's still having a number of issues,
Right.
then he gets it later. And my hope is it doesn't go in that direction. It
Yeah.
usually doesn't go in that direction. Sometimes it goes in that direction.
Yeah. Yeah. And I think, again, with those guys, like, they get MRIs right away and they
Yeah.
figure it out.
But this is one of those tricky things where, like, the MRI doesn't always tell the picture.
Right.
The rubber meets the road when you challenge the knee. Like,
Yeah,
are you going to
100%.
be symptomatic or you're not going to be
Right.
symptomatic?
Right. And with that being said, of like the quick MRI usage in the NFL, brings us to our next topic of discussion. Arande Gatson, from the tight end from the Chargers.
Yeah. I didn't realize that his dad was Arande Gatson, tight end for, I think, Miami.
Oh, yeah.
Yeah. I didn't realize that.
Right. You connect the dots, right?
Yeah. And then I was at lacrosse with one of my friends, with our kids, and he asked me to be a big Syracuse fan, and he's like, that's his son.
Yeah.
I don't know why I didn't connect it, but now,
Right.
yeah, you're right.
Right. And I think, so this is a bit of a soapbox on my end for whatnot. So he took a hit to his lower, kind of to his knee, kind of right above his kneecap there for the most part. And then reports said that everything came back pretty good, and then he had just a femoral contusion via MRI diagnosis. And I was like, okay, that's great. I'm glad that he's not, severely injured, nothing bad. But I think the snowball effect of this is that the general public thinks they need a MRI for a knee contusion, for everything, right? And I think the ripple of the NFL in our world of, like, people I'm sure come and see you and they're like almost demanding an MRI for something. So
my finger hurts a little. MRI?
MRI,
no.
right. It's like, well, no, we have these clinical exam tests that tells us that you really could have X, Y, Z, and it's really not needed, but everyone forces this MRI idea.
Yeah. And the insurance is fighting it off like crazy.
Oh, right.
Sometimes warranted, sometimes not.
Yeah. So about the MRIs, right?
Yeah.
Oh, we'll go into that too. But funny story. So this past weekend, as maybe I've mentioned on the show, I work with the Philadelphia Wings indoor lacrosse team,
awesome,
as well.
Yeah.
And we just did their physicals, and this year, for some whatever reasons, we had to do the physicals in Toronto.
Yeah, you're just.
So I went to Toronto for a quick little trip there, and we had a physician from Canada help us out with physicals, and we were talking about Canadian healthcare, which is really interesting.
Yeah, very different model.
So different. Everyone thinks it's a fantastic thing that everyone gets it or whatnot.
Unless you live in Canada sometimes.
Right, and some people say the opposite. So the physician was telling us a story of a patient that he was working with or knew about. I think it was a female. She suspected ACL tear, so he sent her to a pretty well-known orthopedic up there, and they ordered a rushed MRI. So the injury happened in September.
Yeah.
And so the rushed MRI was scheduled for March.
Ration care, man. It's a different ballgame.
Right? It's a whole different ballgame up there when it's all, say what you want about the difference in healthcare, but it's like, that's crazy in that you're waiting 6 months to get this MRI done for something that could be almost healed in 6 months if diagnosed and treated correctly, right, kind of like right away.
You're pretty far along in the recovery process.
Right.
Yeah.
And I was like, holy cow, that story is crazy.
Yeah.
So
it doesn't end there. Like, total knees in Canada are a very, very hard thing to get.
Yeah.
My wife's family is from Montreal.
Okay.
And her grandmother had broken her hip, and I think it was like 8 days or something before she got surgery, and like the rate of complications goes through the roof.
Oh yeah.
At that point, like that's not an acceptable thing.
Right.
Not just like something you would want, but like the actual outcomes are far worse.
Yeah.
And I don't know, it's Canadian care. Yeah. So there are definitely pluses to it, but there are definitely minuses to it that we don't always necessarily
right. And
know
I
about.
think it's just one of those things that doesn't usually get talked about, but that was like
Sure.
a crazy story. I was like, holy cow, that's real wild.
Yeah.
So where are we at here? We got a couple more to discuss.
So with Arande Gadsden, what is the concern with that heavy knee into the
right.
thigh?
So
that shows up later.
Yeah, so I think with that femoral contusion, what you would be worried about is repeated injury, right? In football, there's a good chance that he takes another helmet or shoulder pad to the knee again. And if you keep banging on a bruise over and over and over again, you can kind of get what's called myositis ossificans, which is calcification of the soft tissue in your body, which is really, really not good.
Yeah, hurts like heck.
Hurts like God knows what.
Usually runs its course. It's usually like in the end okay. You can leave it alone, but sometimes it isn't.
Yeah. You know, and I've had situations where I think I've seen this a few times in my career of like we're like really concerned about it for certain different things.
Yeah.
I remember once I was at a high school setting and a high school lacrosse player kept getting cross-checked in the arm and didn't really say anything. And then he decided to come in and he couldn't bend his elbow past like he had no extension.
It just locks up.
Just locked.
Yeah.
And I was like, well, what made you think to come in now? He's like, oh, I couldn't really like use my stick anymore. I couldn't move. I was like, you had a lot of degrees to figure that out before you came in. But hey, now we're here and you treat it as such. And like you said, most of the time it kind of works itself out.
It matures. And then when it does, the pain goes away and you get most of your motion back. But every now and again, it doesn't. They don't get over the hump.
And it's crazy, right? Because like, what a defense mechanism for your body from like repeated trauma. It's like, okay, we're going to harden this tissue.
Just make it bone.
We're just going to make a shield.
It's not really bone, but yeah.
Right,
It's just going to make a shield.
Just make a shield, a calcified shield on the soft tissue that's going to like protect you from future trauma there.
Right.
But that's the biggest concern with, like we said, with Gadsden there is like, he's a pretty big dude. He's lighting it up right now. He's doing really good.
He's good, man.
Someone's going to tackle him and hit him in his quad again. It's going to
happen over and
It's
over.
going to happen. So you want to protect it. Another thing, too, is, again, a bit of a soapbox is that this era of football players thinks that looking cool is so much more important than protective padding, and knee pads aren't cool anymore. And it's like, well, like we just mentioned, growing a calcified piece of tissue in your quad isn't cool either, but that's why you wear knee pads.
Yeah, that's right.
And I think it's something that I see all the time with all our guys in the college level. I know it's in the high school level.
Just pull them out and throw them.
They pull them out, throw them. They'll cut them up, make them really small. It's like they're serve a purpose, whether you look too cool or not. But use it effectively, and you can prevent these kind of crazy injuries. So you don't want that to happen to you.
Yeah.
So then before we go ahead here, we also have Davante Adams from the Los Angeles Rams.
Yeah. Not the youngest player on
not the youngest, NFL. And he went down, unfortunately, like a very old man. It was not, it's funny when I looked up this, I think I sent you the one video that kind of did like a recap of this past week's injuries. Yeah. And it was Davante Adams. He went to go run a route, try to make a move. Then he stopped and just grabbed his lower back. I was like, oh. And then like the following video was someone who was like watching the video and making just jokes about him. Like, oh, we are definitely in the old man era of all these guys that were so great at one point in time.
Yeah, yeah.
And you try to go run a route and then you're grabbing your back.
Yeah.
I think the reports are saying it's an oblique injury, which are also really nagging and annoying.
Yeah.
But Davante's
not as annoying as hamstrings, but annoying.
Davante Adams is quite the unique athlete, if you will, and he's been known to play through a lot of pain.
Yeah.
He also has some real crazy history of, I think he broke his humerus like 2 or 3 times growing up.
You're kidding.
And I don't know where I saw this video, but like his one arm is like kind of shorter than the other and doesn't have this good range of motion. It's like, wait a minute, you're telling me arguably one of the better receivers in this last decade doesn't have like a normal working arm, like complete, like it's like there's a range of motion deficit between the two. And
what could have been.
Right.
Holy
like,
cow.
Right. If he didn't break his arm 3 different times growing up and it didn't affect his growth or whatnot. But
that's interesting.
And with that being said, we've mentioned his quarterback, Matt Stafford, back in earlier in the show of having some back pains or other things like that, old man injuries.
Previous episode, right? Yeah. Old man Stafford.
Finally hit above 500 career record. Which is crazy to say out loud.
I was shocked when you said that.
Yeah.
When you told me that. Yeah.
I think he's, I don't know, it's like 124 and 1 or something along those lines or something.
Yeah.
But it's crazy that all those years in Detroit really affected him.
Where they weren't good, because they're good now.
Yeah. And now he went to the Rams, and he's been doing pretty well since. And then lastly, it's not a Sports Medicine on Tap episode if we don't talk about Joel Embiid. Tonight it came out on a report that he is out tonight from the game with the Sixers with some knee soreness, and he's getting evaluated.
Hey, man, if it's just soreness.
By the doctors, right?
But it was only a matter. I'll be honest, and I hate to say this, but like, been a better start than I thought it would be.
Mm-hmm.
You know, like he's you know, maybe hopefully this is part of that load management issue where he's slimmed down. He looks good on the court.
Yeah,
to his credit.
he's moving pretty good.
Yeah,
right?
yeah, and better than I had anticipated. You know, Joel Embiid of 4 years ago, I think is long gone, and now we want Joel Embiid of like just a good Joel Embiid, and we'll take it. Yeah, yeah.
And I think the benefit now is that he has a bit of a supporting staff.
Yeah. Wow, they are good.
Edge going
Holy
crazy.
cow.
Maxey looking great.
Yeah, yeah.
And then
Kane comes back.
this other guy,
Oubre's playing out of his mind.
yeah, Oubre, and then Watford, I think is his
Yeah,
name. Who
yeah,
had a triple double the other night, and it was funny. So I think the game was on Saturday night. And is when he had that triple-double, did really well. He was interviewed after the game. I was like, I have no idea who that guy is. Didn't look him up. I was like, I got to Google him because I don't know who that is. Went about my business, and then the next day we had a family party for my son, and we were all talking about the Sixers, and they were like, oh, yeah, the Watford guy. I was like, does anyone know who he is?
Right.
I don't know where he came from. We looked him up. He's like a 4-year vet. He's kind of bounced around between, I don't even know. He did a couple years. He might have been on the Knicks or the Nets. I think the Nets. And then before that, he was one other place, and he came, and he's just really doing pretty good for us,
Sometimes
too.
people just need a shot.
And he's in
They
the
need a
starting
chance.
lineup, so it's
Yeah.
like, oh, hey, whatever works, man. And I think that's the biggest thing, right? To take the load off of him, Joel Embiid's back and his knee, more or
his
less.
knee, yeah.
And then you get all these other guys, these perimeter guys, and these younger guys doing really well.
Yeah.
There's a chance still,
Yeah.
ish. I
Yeah.
mean, I'm not going to go crazy. All my eggs are not in that basket yet as a seasoned Sixers fan who's seen it all before.
Right.
We'll kind of see how that unfolds as we go forward here.
Way more promising start than it.
Yeah.
And like not like outrageous, right? Like but a way more promising, I think, than anticipated.
Yeah.
You gotta give him credit for that.
No, 100%.
Embiid and the Sixers as a whole.
Yeah.
Right, yeah.
They're looking pretty good. They're
Yeah.
winning good games. They had a real crazy game.
Yeah.
I think the game that I was referencing with the Watford triple doubles against Toronto was a back and forth game. I watched most of it. So that's, again, good to see. But again, I think as many Sixers fans know, don't get too excited too early. We got a lot of basketball still to
it's
play.
early.
It's
It's
super early.
Yeah, talk to me in the spring.
Yeah, exactly. And then we'll see what happens. So, Dr. Frey, anything else we didn't cover that you want to touch on?
No, but I think we got a lot of exciting episodes on the horizon.
Oh, yes. We got a lot of things in the background working up. And hopefully we get some exciting guests for all you listeners out there.
Yeah.
So before we go ahead and close out our tab for the evening, we're just going to give a quick shout out to our sponsors, Virtual Orthopedics and Spine. They have you covered from runner's knee and dog walker's hip. Guess what? They have a doc for that. Yard work back and laptop wrist. They have a doc for that too. Virtual Orthopedics and Spine has over 120 providers, over 20 PT and rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtua.org/ortho. Neck of the Woods Brewing Company giving us the most delicious beer in South Jersey. Tonight we went with a regular beer. Very good.
Yeah. Little Oktoberfestin.
Little Oktoberfest as well.
Delicious.
And then I also had a Stay in the Car Frank Watermelon Edition.
Yeah.
Really crazy good.
Yeah.
I ventured off my sours for the night.
Yeah.
And then lastly, Timber Reel Production helping us get all this media out to all of our listeners, video, audio, and everything else in between. So give us a like on social media, on Instagram and YouTube, and then we'll see you folks next time. Appreciate you.